In a society as diverse as ours, behavioral health professionals are increasingly called to respond with care, compassion, and competence to individuals from all walks of life. For emerging professionals, especially those serving in underserved communities, practicing cultural sensitivity isn't just a best practice, it's an ethical responsibility. A trauma-informed, culturally responsive approach fosters healing, reduces stigma, and helps ensure no one is left behind. Tools like Rising Beyond Barriers from TAC Healing Rise guide professionals through cultural nuance with respect and humility. What is cultural sensitivity in behavioral health? Cultural sensitivity means being aware of, respecting, and valuing clients' identities, beliefs, practices, and histories. But it's not just about knowing facts. It's about approaching each person with humility, openness, and reflection. In therapy, this includes acknowledging how culture shapes mental health understanding, validating culturally specific expressions of distress and healing, being mindful of language, family roles, and spiritual practices. When we practice cultural sensitivity, we build trust, we reduce harm, we strengthen relationships and honor the whole person, not just their diagnosis. Why it matters. When clinicians lack cultural awareness, clients can feel misunderstood, dismissed, or even re-traumatized. A simple misreading, like assuming a client's lack of eye contact signals resistance, could overlook a cultural norm where eye contact with authority figures is seen as disrespectful. These mismatches can lead to misdiagnoses, dropout, or deep mistrust in mental health systems. But when care is culturally responsive, clients feel seen, and healing becomes possible. Trauma-informed cultural sensitivity. Many clients, especially from marginalized communities, carry trauma rooted in racism, displacement, poverty, or systemic injustice. A trauma-informed approach asks not "what's wrong with you," but "what have you survived?" And cultural sensitivity asks, how has your culture shaped your healing? How can we support you in a way that empowers, not pathologizes? TAC Healing Rise's Rising Beyond Barriers helps providers integrate this awareness through reflective exercises and case studies. Best practices for cultural sensitivity. 1. Practice cultural humility, not mastery. You don't need to know every tradition, just be curious. Ask about your client's values and supports. Admit what you don't know. Reflect on your own cultural lens. 2. Use interpreters thoughtfully. Language matters. Always work with trained interpreters, not family. Brief them on emotional context. Speak directly to your client. 3. Adapt your communication style. Cultures vary in emotional expression and communication tone. Use storytelling or metaphor when helpful. Match the client's pace. Be aware of how your tone may be perceived. 4. Understand family and community roles. Healing is often communal. Invite family members when appropriate. Explore spiritual and community supports. Recognize role shifts, like children becoming translators in immigrant families. 5. Acknowledge historical harm. Some communities carry trauma from colonization, slavery, or systemic abuse. Build trust through transparency. Center consent and empowerment. Putting it into practice. Intake and assessment. Use culturally adapted screening tools. Ask about identity, spirituality, and healing practices. In diagnosis. Avoid over-pathologizing. Consider cultural expressions of distress, like somatic pain or spiritual crisis. In treatment planning. Co-create goals. Ask what healing means to them. Respect preferences around medicine, therapy, or traditional practices. In documentation. Avoid labels like non-compliant. Highlight strengths and resilience. Reflect collaborative decision-making. Self-awareness. The heart of cultural sensitivity. The work begins within. Ask yourself, what are my assumptions when someone is late or silent? What values am I projecting? How do I respond when I don't understand a cultural practice? Rising Beyond Barriers offers tools to help professionals explore these questions, move through bias, and practice with greater compassion. For emerging professionals, if you're just starting your journey, now is the time to build your foundation. Seek supervisors who prioritize cultural reflection. Engage with local communities and leaders. Learn to speak in ways that uplift and respect cultural strengths. Books like Rising Beyond Barriers provide structured guidance to help you navigate language barriers, trauma, and family-centered care with integrity. Healing Beyond the Therapy Room. Cultural sensitivity includes advocacy and collaboration. It means supporting culturally rooted healing spaces like barbershops, churches, or mutual aid circles. Working alongside community health workers. Pushing for funding and policies that support culturally grounded care. In many communities, healing begins far from clinical settings. As professionals, we must honor that reality and adapt accordingly. Final thoughts. Be curious. Be present. Cultural sensitivity is not a box to check. It's a lifelong practice. It's about showing up with compassion, listening more than speaking, and holding space for stories that may be different from your own. In a world where mental health needs are rising and trust is scarce, culturally responsive, trauma-informed care is not optional. It's essential. You don't have to be perfect, you just have to be present. If you found this video helpful, please like, subscribe, and share your thoughts in the comments.